Hello and welcome to Rewired Mind Counseling Podcast. My name is Esther Obonda and I am the host of this show. Thank you for joining us for today's pioneering podcast on overcoming anxiety and depression using coping mechanisms. This will be achieved by integrating faith-based and clinical approaches and exploring ways that anxiety can be minimized, managed, or eliminated. I will be explaining my approaches in detail in my subsequent podcasts. And welcome to the Rewired Mind Counseling Podcast. So my name is Esther Obonda and I'm the host for this show. On today's podcast, we are also blessed to have our guest, who is Dr. Teresa Chrisman. Happy to meet with you today.
Thank you.
Yes. Thank you for joining us for today's podcast, episode 8.1 on overcoming anxiety and depression through the application of various coping tools. This will be achieved by integrating various faith-based and clinical approaches in order to discover the numerous ways anxiety can be lessened or managed or even eliminated. So today, Dr. Chrisman will be sharing her expertise, experiences, and thoughts on anxiety and depression, and how to help the older adult population to seek treatment. In my previous episode, which was episode 7.1, the discourse was on anxiety, depression, and trauma. Today, I have the pleasure of introducing Dr. Teresa Chrisman, and I will give her the chance to introduce herself properly. Over to you, Dr. Chrisman.
Thank you, Esther. I'm just privileged to be here.
Oh, yes.
Appreciate you inviting me.
Thank you.
Thank you.
Thank you.
Esther and I go a ways back when we both moved to Houston from far off lands. I moved down to Houston from Alaska. I'm born and bred Alaskan. My parents from Alaska, my grandparents moved to Alaska. And came to the lower 48, or Texas, to finish my education, my bachelor's and my, no, not my bachelor's. Bachelor's was in Fairbanks, Alaska, my master's and doctorate in social work gerontology. And I'm a mother of 3 and a grandmother of 4. Yeah.
Praise God.
Yes, yeah. I am very blessed. Yeah. Yeah. They tickle me to no end.
Oh.
Yeah. Yeah. They make me laugh. My focus in social work is on gerontology, the scientific study of aging, and also issues surrounding older adults. I also focused in on reminiscence and life story work and how that using that not therapeutically has much evidence for therapy, but also because it does have evidence to reduce depression, it is many times non-invasive, and it's a great approach with older adults, non-threatening, where they can feel like everyone has a story to tell, and it's a fun and a natural response is, what's it like when you were a little kid? And it's a great way to broach counseling and issues, emotional, psychological issues with older adults. And I know we'll get further into that.
Yes. Right.
Yeah.
It's interesting.
Mm-hmm.
I welcome you to this show.
Thank
and
you.
As I said earlier on, I'm blessed to have you
Thank you, Esther.
as one of our guests.
Thank you. Esther, I forgot to say, and I'm married to Ken for almost 40 years.
Wow.
Yes. You'll want to make sure I put a plug in. Yeah.
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 Oh, lovely, lovely. So today, I would like to ask you some questions about your, experiences, your knowledge. You have a lot to, let share with us.
Okay.
The world needs help, especially our aging population.
Correct.
Yeah. Right. Anxiety. So these are the questions. In helping the older adult population to seek treatment, what are their hindrances that limits the older adult population that has mental health issues from accessing and benefiting from the treatment therapy?
Well,
Did you understand the question?
I think so.
Okay, I'll read it again.
Sure.
Right. Are there hindrances that limit the older adult population with mental health issues from accessing and benefiting from treatment therapy?
So the baby boomer generation is one of the most common groups. The baby boomer generation is those that were born between World War II and the mid-1960s. And that generation is the most common to avoid or delay getting any medical assistance. There's an extreme stigmatization, which makes it difficult for them to address issues around mental health. Today's older population is the least likely to seek out help. Many of them view mental illness or seeking help as a sign of weakness. And they are unlikely to admit they have any problems. And there's also the fear that if I admit I have a problem, maybe I will lose my independence. So too many consider that dementia and depression are a normal part of aging, and they're not.
That's a faulty thinking.
Yes, it is. Yes, it is. It's not a normal part of aging.
It's not.
Right.
It's not.
Right. It is something that can be addressed, that it can be dealt with, and it is not normal.
It's not. That's
right.
Yeah.
Right.
It's not normal.
Another thing is many older adults lack access to services. Besides realizing that there's stigma with seeking help, they also have lack of access to getting help.
Yeah. They lack access, is it?
They lack
they
access.
Do. Yeah.
Correct.
Okay.
Let's see if I... with many older adults, they don't acknowledge that they have the symptoms. It comes out as a physical problem that I'm having. I'm having gut issues. I'm having headaches. I'm not sleeping well. They don't address it as psychological issues going on. So that could be a key aspect to listen as a clinician, is that when somebody starts talking about physical issues going on, maybe that is the way they're trying to communicate that there's some emotional issues going on or psychological issues going on.
Okay.
Yeah.
Yeah. That's what it is.
Yeah.
Yeah. The thing I see there is that they do not acknowledge they have problem. That there is problem.
Right.
Is it them not acknowledging that they have problem? Do you think it's arising from ignorance, or they know it, but they don't want to acknowledge it and accept it? What do you think?
Maybe a little of both, but they've spent older adults. Growing old is not for the faint of heart.
No.
It's hard. And they
hard.
have had coping mechanisms that maybe they've dealt with anxiety and depression their whole life.
Yes.
And now you're an 80-year-old or in their 70s, and you're realizing, you've got depression or anxiety, but you've always been able to pull yourself up by the bootstraps. You've always been able to just push on. or maybe you were working and had a lot of distractions, and now you're left to yourself and to realize, I can't pull myself up by my bootstraps anymore. And so I don't know so much as ignorance as they've been plowing through and lack of, and there's extreme stigmatism for that. If you have to seek out help for mental health issues, then there's something wrong with you, or you're weak, or it's just really a flaw.
They're considered society sees that as weakness, even being crazy and not normal. So because of that, they don't want to even show that they have problem.
Right. 50 years ago, that was something that, golly, you didn't want to go to the funny farm or, institutions. That was a really horrific thing and a scary thing to be separated from your family, put in an institution and locked doors. So there's a lot of stigma and fear with that, where we have normalized a lot with counseling. Younger generations that feel like it's acceptable to go to counseling. And they feel like they have a little more control over, I get to go to counseling, where older adults have a lot that their baggage that they are bringing with them, experiences. Aunt Bertha went to the funny farm and was there for 3 years, and so that's a fearful thing. So
it comes with fear as well. Is
sure.
that right?
Sure.
Okay.
Yeah.
I can see that is true because the younger generation are getting more enlightened.
Sure.
And knowing that this is same having mental health issues is also like having any other physical, health issues.
Correct.
So now they are seeking help.
Correct.
So majority of my clients come from the younger generation because now they are, learning, knowing, understanding what is going on.
Sure. Yeah. Right.
And sadly, some of them, when they come, I get to know that their relations wouldn't be happy, knowing that they went seeking therapy.
I think that's why a lot of times with older adults, they physical problems is the way that they express that there is psychological problems going on. It's acceptable to say, my stomach's upset today, or I have a headache. Those were acceptable ways of saying that. But then as a clinician, you need to understand that maybe they're unable to say that I'm really sad. I have panic attacks. I'm depressed. I'm grieving. And so it comes out as physical issues. So they go to their primary care physician, and the primary care physician is looking for aches and pains, lack of sleep, things that we, as looking at younger generations, we might say, depression. But you've got other people looking at an older adult and say, okay, you're not sleeping. Well, let's look at this. You've got aches and pains. Well, let's look at this physical issue. And it's all looking at physical issues when many times the medical community is not looking at the psychological issues.
That's right. That's correct.
Yeah.
Yes.
Yeah.
That's a problem.
Yes, it is. Yeah.
So these things need to be addressed.
Right. Yeah.
All right. Let's move on, and then at some point you will let us know how. This is good. This is a broad topic anyway.
Yeah, it is.
And honestly, I would love to have you back to as we go on, you see the areas that need to be addressed and how we can help the older adult population to come out from their shells, and it's not too late to seek help.
It's not. No, it's not.
Yeah. They may be thinking also that it's too late.
Exactly.
I just it's like the attitude of I'd rather stay like this and die this way and all that.
That's right. Right.
Okay.
Yes.
Right. The second question is if you can share your thoughts on the popular beliefs.
Didn't understand that.
Wow. I'm always having this problem. I'm doing something, the phone will tell me what. Did I ask them any questions?
No.
It's becoming intrusive.
Yes, it is. Yeah.
Anyway, right. I would like you to share your thoughts on the popular beliefs amongst the older adults that anxiety and depression are a normal phenomenon and are associated with aging.
Mm-hmm. Yeah.
Did you understand the question?
Yeah.
Or should I?
Well, I think it's not just a popular belief among older adults. It's a popular belief among our society.
Okay.
That
Okay, not just among
not
older
just
adults.
older adults,
Okay.
younger people. It was aging was largely defined in our society from a medical perspective. You're declining. You're born, and then eventually you're going to die, and the whole spectrum of your life is on a decline. And so we have emphasized that, and it's kind of why we had nursing homes arise, institutions where we can put them where they can just decline until they die. So a lot of theories and beliefs said that it was natural for adults, older adults, to just withdraw. They want to withdraw. They want to die alone. And so it was called a disengagement theory. But and our society accepted that was a natural part of aging. The medical community said institutions are good, put the older adults in institutions. And we have really deinstitutionalized a lot of things in our society, orphanages. We've, eliminated a lot of this, but nursing homes are still have the medical model of care where you just, many of the people go there and it's like the end of the road. We just want to disengage. But there's a number of rising theories that are coming out that are positive aging. And the idea is that as people age, they transcend the limited views that they had earlier in life. And depression, they're a little more freer to dress and do and say what maybe they were inhibited as younger people. So depression, it's so much of like 80% of older adults have some physical issue they're dealing with. They might be medicated for arthritis, heart issues, and so on. So many of them have a health issue, a chronic health condition that they're dealing with. But that doesn't mean that depression has to go along with that. Now, it might bring you low at times, but it's not something that we have to live with. It's not a normal part of aging to become depressed. And if I feel like if we could encourage older adults and the younger people that, hey, you're free to do what you want. And it's not, we're so careful. I think we've done a lot with the younger children. They're a little more free, or we can free to do and be. But I think with the older adults, teaching them that you're free to do and be who you want to be now. If you want to go back to school, and I know that there's a lot of programs happening now where older adults can go to college. And
I do see the adverts.
Yes,
it's encouraging.
It is encouraging, yeah.
The other day I saw somebody, on LinkedIn. She was so proud to show her certificate for a PhD in something. I can't remember what it was.
Yes,
at 63. So
right.
It's encouraging.
Yes, it is. There's a lot that older adults can offer with wisdom, experience, and we ought to honor that.
That's right. You're right. That's right. That takes me back to some time ago in London. There was this neighbor that came to our meeting, our social gathering. She came and then I got to know that she's in one of the universities called University of the Third Age. Yes.
Okay.
I asked her what it meant, and she said, she told me that learning, in fact, she was an ex-Oxford, I think either Oxford and Cambridge, herself and her husband. So they studied either in Oxford or Cambridge, one of those.
Okay.
And they loved learning. So she told me that learning has been part of her life. She loves learning and she wouldn't stop learning. Unfortunately, her husband passed. So she said the aim of the University of the Third Age is to, bring, share various experiences,
Yes.
of life and all
Yeah.
that, and keep learning going.
Yes.
And by so doing, they are helping themselves not
Sure.
to, have dementia and all that.
Sure.
To make life more fun and
Sure.
interesting for the older adults.
Sure.
So,
Sure.
like, you can come in your, field as a social worker. You are very learned in that. You can come share your experiences, and that's how everybody pitches in and share
Right.
what they've learned over the years.
Exactly.
So it's
Exactly.
pulling a group of people together with various life experiences.
Right.
So
right.
that's what the University of the Third Age is all
love it.
about us, and it helps them to go from place to place,
Yeah.
having fun. So they're having, at the same time, they're having good social outlets.
Sure.
Fun,
Sure.
sharing with one another.
Yes. Yeah.
So, and that keeps them going.
Yes.
Yeah.
Purpose.
That's right.
That's
That's
right.
right. Giving
Yeah.
little or no room for anxiety
That's
and all
right.
that.
That's right.
Yeah, so it's good.
Right.
Yeah. Older
Yeah.
adults need to find more ways to
Yeah. Engage.
engage their
Yes.
minds.
Right.
Yes.
And engage is not, so they're not isolated.
Uh-huh.
But again, to go back to your question, anxiety and depression are not a normal part of aging. There might be episodes that you go through, that we all go through, but it's not a normal, and young people should hear that too, is that grandma's depressed. Well, then maybe she needs to have a phone call a day or something. But just to think that it's normal and they can be depressed until they die is it's really a sad thing that it, very sad thing.
Good. I'm glad you highlighted that. It should not be
It should
a
not.
normal, thing about aging.
No,
Yeah,
no, not
that's
at all.
right. That's not how it should
Right,
be.
right,
Yeah.
exactly. Yeah.
Okay. Now, the third question is, are there effective ways older adults with anxiety and depression can be encouraged to adopt positive attitudes and beliefs in order to help them get help, in order to seek help?
I think, again, normalizing therapy, that normalizing going for help is okay. They go to the doctor. If we could normalize that down the hall from your primary care physician is the counselor, if not just the older adult, but our society said that here's your primary care and 2 doors down is the social worker, counselor, ready to listen. And if we normalize that, and it doesn't mean that you have to go on a couch and lie down and the whole old movie stigma, that you're going to lie down on a couch and they're going to tell you just to talk. And also that it is work. It's not a magic pill, not one time and I'm going to swallow a pill and I'm going to be happy. It's going to be some work.
Yes.
And not to say that the older generation, baby boomer generation, they know about work and hard work. So I think if you come right out and say it's going to be work, but we're going to work through it together,
That's right.
is a great approach. So not to be afraid to say it's going to be work, but we can do it. Also, there is logistics. Older adults, maybe they don't drive anymore. So getting to a counselor, just to say meet with a counselor once a week, that could be a huge issue. If they're not taking the bus or they're at a senior facility that they've got to go on the transportation that the facility provides, then other people know that they're going to the counseling. You got to put... So I think logistically wise too, transportation can be a real issue.
That's true.
Yeah, it's hard to get.
It is.
Yeah, from A to B, and maybe younger generation that hop in the car might not think about that logistically it can be tough.
Yeah, it can be tough. It
Yeah.
can be some form of limitation
Right.
in seeking help.
Right.
That's true.
Yeah.
That's true.
And medication is not always the answer. And you know this as a therapist, that and older adults, you know, a huge majority of them are on some sort of medication. And age-related changes can change the way we metabolize medications. So there is a real caution, and a lot of the medications are tested on younger populations. So antidepressants are tested on an age group from 20 to 40. They're not tested on an 80 or 90-year-old. And so the reaction or the interaction between drugs can be real issues for an older adult. So to me, it's always better to start with, of course, I'm not talking major depression. I'm talking about, you know, I'm depressed, not major depression.
Not major, like mild.
Yes, right. I mean, because I know there is times that you will need medication.
Yes.
So we're not talking up to that extreme. I'm talking about that looking at therapies, cognitive behavioral therapy, reminiscence therapy, counseling, talking, is a much can be a very effective way for older adults to deal with depression and anxiety. It's having someone to share with.
Yeah, having someone to share with.
Share and talk.
The support system.
Yes, exactly.
Having a strong support system.
Right.
And that's what most elderly people lack.
Yeah, right.
That is not strong. You know, when you and I were in the elementary school or secondary, or, you know, we could go on the playground and say, hey, can you be my friend?
Yes.
And then friendship begins.
Yes.
By the end of the day, you've gathered too many friends.
Yes.
And you get along. So by the time you get to college, it starts narrowing. It could widen, maybe because you belong to too many groups and you go along partying and all that.
Sure.
But once you leave that college life and go into the real world, it starts narrowing.
Sure.
And it narrows things out when
sure.
you come to the that older adult group.
Right.
You know, because maybe you've lost friends, you've lost through death or too many, you know.
Yes.
So that's the time of loneliness and isolation.
Yes. Right. Right. And in our society, you know, me being an Alaskan, so most of my family's in Alaska, and here I am in Texas. So a lot of our my parents moved to Arizona, my in-laws, Oklahoma and Arkansas, and we're all so spread out.
Yes,
so it's very difficult where societies were smaller and you're able to help mom and dad walk across the street and or live together. And now we are so spread out that it's very hard, and isolation is a real critical issue, and it does contribute to depression, mental decline, and physical ailments. So it is a serious issue in the U.S.
Isolation.
Yeah, isolation.
In fact, it's not just only in the U.S. It's even in Nigeria, where I come from. You know, there is this drift from the rural areas to the cities because of in search of economy and all that.
Okay.
So the elderly, are lonely and isolated.
Right.
Especially those who are ill, that cannot move about and seek medical help and all that.
Right.
And logistics, as you pointed out, is an issue.
Yeah, right. Exactly.
Logistics, how they can get from this place to that place and get help. Thank you for listening to this podcast episode 8.1. And please stay tuned for episode 8.2. Thank you.